Yay! Hey, Pete.
There we go. I have to look like this because of my bifocals.
Hey, look, I was just telling them how bad I am at technology in general, and that we were going to try to save this live to share to our other platforms, and I can't find that share thing or the save thing.
I think it is at the very end.
It is okay.
Like when you exit the live, it'll ask you if you want to save it.
Okay, I hope you're right.
So as we hit the little button in the upper right corner and you say end live, and then you get your white page that gives you your breakdown of how it went. There's usually
Oh, see,
an option to save it.
and this. I haven't been on TikTok a whole lot in the last probably like year or so. It just got to be a lot,
Yeah,
it got to be pretty heavy.
yeah,
So I'm trying to venture back in, dip my toe back in. So thank you for
sure.
welcoming me back in into TikTok. So thank you for everybody that's here. If you don't know, Pete and I did residency together, although he
Mhm.
was a year ahead of me. 1 or 2 years? One
Just the one.
one year, okay. He was a year ahead of me, and we won't tell you how long ago that was. Just a few years. It's just a few years. But
Just a
and
few.
yeah, and Pete, I don't know how often you've said this lately, but I've said, and we're going to keep track of the questions and we'll conquer those as we can. But I've said so many times lately, I've quoted like Dr. Gilmore, Dr. Hanna, Dr. Bugnitz, some of our attendings from residency when they
Mhm.
said, you guys are so lucky that we have vaccines. You don't
Yes.
have to see pertussis. You don't have to see, I remember them talking quite a bit about Haemophilus influenza and how
Oh
bad
yeah.
that was. And so now that we are dropped our herd immunity for several infectious diseases and we're starting to see those again, it, I I just keep coming back to those conversations with them.
Yeah.
Like we had it, we didn't realize how good we had it.
Yeah.
I think because we never had to see those things before.
Yeah. I mean, probably the only vaccine preventable illness that we have a lot of experience with, because the vaccine wasn't until the end of our residency, was rotavirus.
Yeah,
And so we have a lot of experience with that. But in
yeah,
terms of Prevnar, which does pneumonia, we saw very few severe pneumonias, maybe one or two that required surgical intervention and medical intervention. And even when I got to an attending level, I had one patient that got very, very sick and started to look like that. Uh, and I got him transferred to the children's hospital, but because of pneumonia vaccine, we don't see the severity of pneumonia, which the main severity we're worried about is that it goes from infection to pocket of infection outside the lung. So something that we call empyema. So it's an infection in between the lung and the chest wall, and that does require surgery. So we
yeah.
definitely see less of that because of the pneumonia vaccine. Pardon my burping teenager.
Look, I'm closed in the bedroom. I told like Jimmy's at lacrosse. Henry's playing on his VR headset. Please, no judgment, everybody. He's done his homework. He's done the things right, and then the dogs are right now sleeping in the living room. So
Oh, very good.
it's for the moment quiet. It will not stay that way. I can guarantee you. And then
Yes.
I like a house of boys here too. So I didn't even.
Yes.
That's like white noise to me. It's like
It's
boys
normal.
burping and
Yes.
farting. Yeah. No, you're right. And just to clarify what you said about the rotavirus vaccine and us seeing the biggest impact, like pre and post vaccine, because before the vaccine, we would see these kids like dehydrated beyond wow, like
Yes.
wow. And then after the vaccine, it was like, whew, where did everybody go? This is great.
Yeah. It
Yeah.
the only two cases I've seen since the vaccine was introduced were both in children whose parents did not get the vaccine because they chose not to. And one of them spent a week in the hospital, and the other one spent about 4 days in the hospital. Both had to have IV fluids.
Yeah. Yeah. I'm gonna scroll back. Just there was at least one question. I hope I'm not missing any. But let's see. Keat, I hope Keat, asked, how do you feel about chiropractors? And so I have several friends that are chiropractors. And at least for me, if you're thinking about a chiropractor for your child,
Right.
I would talk to your pediatrician first.
Yes.
Because I'm emergency medicine, so I am not the medical home. And so
So
I'll
from
defer to you.
so from primary pediatrics, I would never recommend a pediatric chiropractor because, I mean, at best they might just be giving like a massage behind the ear to relieve eustachian tube dysfunction in an infant, which is not possible anatomically speaking. But if they start to do manipulations and they're high velocity, they could cause significant damage to the blood vessels in the neck. Mostly, that would be what we'd be worried about the most.
Yeah, I'll never forget when I was a medical student, I saw a young mom, she was like in her 30s, who had a carotid dissection.
Yes.
And I just remember her um saying like, how can we fix this, or what can I do? And it was just like, anyway, it was that just really stuck with me.
Yeah, that's
um
that's very sad and very devastating. So we definitely don't want to see any kind of injury like that in a child.
yeah,
I'll
for
go
sure.
back to another question I that we have. How can we effectively communicate and educate people that have decided not to vaccinate their children? So the most effective way that we know of is something called a motivational interview, where we ask genuine questions one after the other until we can get to the root cause of what brought a parent to that decision. And then we can try to present precise, scientific, evidence based information. But at the end of the day, it takes them crossing the critical thinking bridge once we've unraveled the root cause. How did they get there? By asking one question after the other until we get to it. So that's the most effective. Unfortunately, there's also a technique that people will use disingenuinely, and they will ask a question with no intent of learning. They just want to gotcha. And so that and motivational interviewing are so close together, it's hard to tell when you're being asked the question genuinely from a parent that's curious, or you're being disingenuinely approached by someone that has no intent of learning, or no intent of allowing us to figure out how did you get to this decision. So it's a
Yeah,
tough deal. We're stuck in this point. We're stuck at this point where we need plenty of time to do that. And a normal visit doesn't offer that. Like, so a forum like this where we're free to kind of speak and take our time, yeah, we could probably go through a motivational interview with someone if they were accepting of it. So that's the
yeah,
tough part.
yeah. And I'll say from the ER, like we don't have the luxury of time to have these conversations, and so that's why it's so important for people to go to their medical home, and have these conversations with their pediatricians or their family medicine physician, whomever is seeing their family. This is like one of the reasons. So I do like educating families, and I don't have all the time in the world, and so that's one of the reasons I started my Facebook group,
Yes.
was to do these like educational videos for families. And that's one of the reasons I always, when things get too heavy here or in the news, as it pertains to medicine, I just defer back to my Facebook group, which I started in 2019. It was just like, I don't know if you remember, it was just a random post about my now 9 year old that was like, this is the face of 104 fever, and just educating families on what fever is. And a friend said, you should really make more of these. And so I, like, again, really bad with technology and like, do you do a page? Do you do a group? And so I was like, I'll do a group. And then I ended up, for various reasons, converting it to a private group. So it's, so the people that are there want to be there, and the people, for the most part, and the people that are there for those motivational conversations. And I've had so many of those conversations through that group. And it's amazing how many people are just scared to ask a question. They're scared. Their whole family believes a certain thing,
Right.
or their spouse really believes a certain thing, but they really want to know. And so if they know they have a safe space to have those conversations, and I think that it's like people like you and I that are welcoming of those conversations without judgment, and to say, I'm here to listen, and to hear you out with your concerns, because and I will defend some of our colleagues in saying that we've had these discussions for so long now,
Yes.
that for the ones of our colleagues that are like, I'm not doing it anymore, you're
Yeah.
get vaccinated or get out, like, but that comes from a place of frustration, because
Right.
they have done this for so long, and they've seen the effects of not
Yes.
vaccinating kids. So let me just scroll back. Let's see. So much negative news lately. Anything positive going on in the pediatric medical world? Ooh, that's a great question.
We're seeing less flu.
Good for you. We're still like way up there.
Maybe one
Uh,
or two less.
yeah,
From our standpoint, our positive news is like, oh, we have a new treatment, or we have some new research that's really promising. And we're actually concerned that there isn't going to be a lot of that going on moving forward, just because there seems to be an approach to research that's going to be kind of scrutinizing, okay, is this research have anything in it that we don't agree with from a political standpoint? And that's where it's problematic. I mean, research isn't meant to be political. It's meant to kind of just ask a question, look at some options, and determine which option is best to help with that, asking that question. So I mean, I thought it was kind of fascinating. There's a piece about maybe leucovorin could be a possible add-on therapy to help children with autism spectrum that are on the severe nonverbal side. And of course, it needs a lot of study. And the limited group of patients that they looked at were I mean, I've seen some of the studies. I've seen some of the different doctors kind of summarize it, and I agree with their take. It just needs a lot more study. But we want little bits of news like that. Like that. That's like, okay. Let's study that.
yeah. And I don't know
But
about you, but I feel like when I read stuff like that, I'm like,
yeah, yeah. We want things to work, but then we also know, okay, well, let's study that. Let's stay let's stay cautiously optimistic, and let's stay in the, okay, well, this might be a possibility. But, if a parent asks me, I'm going to say, well, this needs to be studied more. So I'm not sure this is a good recommendation for you to try. But if they're real insistent, I'm not gonna be real mean about it. I'll probably say, well, we can try it. Just understand that your insurance may not cover the medication, which technically it is, but it's actually just a vitamin.
yeah.
So that's where some of us might be like, sure, here you go. Here's your folinic acid, and it's relatively harmless. So, but the thing we don't know is, did it really help that one patient because of they had a specific problem? And that's where we need more study, because there is genetic disorders where people have a folate issue getting folate from blood to brain. And that's one thing. That's super rare. I think there's only 20 cases reported of the genetic disorder. So that's probably not the explanation. Now, the explanation that I think it's Dr. Fry, that he proposed, is that there's actually antibodies blocking the folate receptor, and that some children have produced more antibodies against it and therefore prevented folate from getting to the places that it needs to be. So that's
That's really
that's
interesting.
that's his supposition. But then there's the idea of like, okay, so should we test children with ASD, autism spectrum disorder, for this antibody? And then that's an additional question we have to answer, like, who deserves to be tested? Should we test everybody? And then who's going to establish the standard of reference range, so we know, okay, this person, if they're over here, then yes, they need to be treated. Oop, they're over here, they're normal. And then so
Yeah, and I think like when we get information like that, and I'm working my way through Ed Yong. I don't know if you pronounce it Yong or Jong, Yong. He wrote An Immense World and I Contain Multitudes. And so I Contain Multitudes is what I'm working my way through, and it's fascinating. It's about all of the incredible biome that's within your body, right? The microorganisms,
yeah,
the bacteria, the virus, everything, and how we're in this symbiotic relationship. And so there's information in there about behavior disorders in mice and leaky gut and autism and like and there's some of that, and I know like some of that's been really studied and some of that it's harder to do, but all of that to say that I think those of us who are dedicated to educating will take information like that, and we're not going to say like Lucavore and say that's no, that's not right, but we're going to process it and like, oh, let's think through this a bit more and
yeah,
see how this can maybe apply to our patients.
yeah,
um I mean, as far as like specific good pediatric news, I don't know. I just love my patients. I mean,
yeah.
I'm sure you're the same. And they say the cutest things.
Oh my
And
goodness.
I had a little boy the other day who's a really bad asthmatic, and apparently every time he comes in he gets admitted. But I was like, I believe in you, buddy. We're not doing this time. Like I'm giving you the old college try. Like you are not going to be admitted this time, unless like you clinically really need it. And so we got kind of creative and tried a bunch of different things, and he ended up not having to be admitted, and he was so cute, and he was like 5 or 6, and he going on like 35, and he would just say the cutest things.
Yes.
And so when he was like, I really have to go to the bathroom, and I was like, okay, well, I'll unhook you from your pulse ox and send you and your mom to the bathroom. Maybe I can find a toy for you.
Mm-hmm.
And so I found him. My hospital child life is amazing and keeps like these drawers of little toys and fidgets and whatnot for the kids to take home. And so I went and grabbed him a couple of toys, and he had been holding on to this lovey that he left to go to the bathroom. And so when he came back from the bathroom, I had set up his lovey with like a couple of little toys. Like we're not talking huge things, right? Just like little things, and a little popsicle next to it. And he came in and he goes, "What in the world for me? This is why I do this. Like this kid is awesome."
There you
Um,
go.
and so
Yeah.
it's things like that. You're like, okay, that's great.
Yeah.
We had a lot of messages, Pete. I'm just gonna cruise through them.
Yeah. I'll kind of go back and look and see.
Yeah, so sweet Hobby Farm said they are seeing less and less positive flus. It's not over yet, but seeing less, which is awesome. Sarah says, "Hi, you treated my daughter in the ER once. I love your group and videos." Thank you, Sarah. That's so sweet. I love meeting people again. When I've treated their kids.
Oh, that's awesome.
Yeah, and it'll happen like it'll happen in my group, or we'll be at like Walmart or something, or even where we live is heavy foot traffic, like lots of walkers and joggers, and every now and then somebody will stop and say, "Hey, you treated my son for asthma or whatever," or like, "I watched your videos during COVID," and it's always like very well. You treated my kid is a lot less surprising than the "I watch your videos." That's always, I don't know for you, but for me, it's always like, "Whoa, like wow, thank you, wow, thank you." It's very humbling.
Yeah, no, that's really neat because I mean I live in a small town, so I run into people if I just go to Walmart to get food.
Legos.
Like, well, I buy my Lego online, but
Okay,
every
okay.
once in a while, yes, if I get a Lego, then or they tell me, "Oh, did you see that Lego at Walmart?"
That's awesome.
But yeah,
That's
I'll run
awesome.
into patients and families, and sometimes I'll run into former patients, and they remember me, and they're so sweet. They're like, "Do you remember me?" And I'm like, "Of course I do."
That's so great.
Yeah,
It's
of
so
course I
great.
do. So, and so that's fun. Let's see. I'll kind of
This
go
one
back
is
through here and
from Alexandra. I think is a great question. How do you feel about RFK saying that measles outbreaks are common in this country in the press conference? And so in 2000, I think it was 2000, the United States announced that measles had been eradicated
yes,
from this country.
25 years.
So since, but then after, I don't know exactly when we started to see some cases here and there. First death was in 2015 or since the eradication. Um, but but seeing these little pockets of here and
Yes,
there from unvaccinated
right.
communities,
Yeah, I
and
think the first one was 2004. It was a Ohio Amish community. And then this most recent one is the Texas Mennonite community. So, a key thing to understand these are U.S. citizens, they are predominantly unvaccinated. They do it for what they think is religious reasons. Uh, and then, all it takes is one. And that one can turn into 125 in 2 weeks.
yeah,
And
yeah,
I am actually very shocked that one of these sick children has unalived because it usually takes about 500 to 1,000 cases before we start to see one unalive. So that's ahead of schedule.
which
So
is really, and I do think,
I'm
and
concerned
and I
about
didn't.
that.
Well, and
That's
I didn't
concerning.
know that until I saw one of your posts with that number. I do think from what I've seen, this patient, this child had co-infections, which is
Okay.
not uncommon in kids, right?
Right.
So I think RSV was also one of the co-infections,
Then
but
that would
that's
complicate things. Yes.
yeah, yeah. But again, the looking at the mortality rate from RSV alone, measles alone,
Yeah.
but then together, right?
That's a bad
Um,
combo.
it's a bad combo, and it's certainly not uncommon. We don't do it often, but when we're getting that full respiratory infection panel, um, I mean, it's not uncommon for kids to pop positive for two, three, four viruses at once.
Right. Because there could be
Um,
one they're getting over, but they're still showing, PCR detectable.
right.
So, oh, there's a good question. Measles knocks out the immune system, and the answer is yes. So, it specifically will erase immune memory. So, our T cells and our thymus when we're children is responsible for picking things up, saying, I'm going to remember this, and storing that away. And the problem is measles will erase that memory, kind of like hitting Control Alt Delete on your computer. And yes, it will cause immune amnesia, is probably the best way to call it. That is a problem because that can make you susceptible to illness until you're healthy enough to revaccinate, because you would literally have to get revaccinated just like a patient that maybe had a stem cell transplant and had to reset their immune system because of that. So it's that severe. And in the cases where children survive or adults survive and they have that immune amnesia, it can sometimes, that alone can cut their life shorter than what was expected. So yes, survival, but at what cost? So
Yeah.
that's about 50%. I think I've read somewhere that it's upwards than 50%. Immune amnesia is one of the long-term consequences of measles. Yes.
Alexandra's asking, is that immune amnesia permanent? Um, so no, right?
Right.
So for the measles, you'd have to get re-vaccinated.
Revaccinated.
And then I honestly don't know the science on that as it applies to other infectious diseases that we do vaccinate for.
Right.
I don't know. This is like
So it's a T cell issue. So T cells, of course, are related back to viral infection. Uh, they help some with fungal infection, but so you would be thinking about some of the illnesses that we worry about, say with HIV, for a period of time until you kind of your immunity was able to heal a little bit, or you were able to safely re-administer vaccines. So, I mean, that's the thing is like we don't want to overwhelm this already kind of fragile patient. So we would probably want to be especially careful in how we reintroduce antigens to them.
yeah,
But we'd also want to do it as safely as and quickly as possible so that they didn't have uh, enough time in between when their immune amnesia occurred and when they're revaccinated and reboosted. So that's a
yeah,
tough deal. We don't have enough experience with that because it's like we pointed out at the beginning of this talk. We don't, if your doctor is trained when we were trained, we may not have seen all these disorders. If they were another 10 years older than me, maybe some more. They might have seen more pneumonia or Haemophilus influenza B. They might have seen a tad bit of pertussis. But we have to go back to my partner who was the oldest part in my office, and he resigned due to illness. But on top of him being old enough to have seen it in the United States, he had trained in the Middle East where they still saw tetanus because some of the families would take feces from a camel and put it on the
umbilical
umbilicus
cord.
of the newborn because that was supposed to be helpful. Uh, but that gave the infant tetanus.
And so this is
Bad,
like a
bad, bad, bad.
thing, but a perfect segue into CB said there's Facebook posts circulating about people declining the tetanus vaccine after a puncture wound because they don't think the vaccination has any impact on them getting tetanus from the current wound. And I am happy to take this one because this is we basically give like two vaccines in the emergency department.
Right.
One is rabies and the rabies immunoglobulin. Um, when it's epidemiologically, that's a big word, appropriate. And the other is tetanus. So I trained in a pediatric trauma center. I worked in a pediatric trauma center for 15 years. And so pediatric traumas, these dirty contaminated wounds, these crush injuries, they are tetanus prone. We absolutely give tetanus immunizations in the emergency department. And so if they're less than 7 and they've had their full series, then they probably don't need it because they've had the DTaP.
It's
So
close enough. Yeah.
The T in the DTaP, right, is tetanus, and they had it at between ages 4 and 6. So even if they're 6 or 7, they're within the 5 years for a contaminated wound. But if they're older than that, if it's been 5 years, they haven't had a complete series. But if they're older than 7, then we give the Tdap,
Yes.
which there's a little nuanced difference there. But so we do that on a regular basis, and I have had families refuse that vaccine, and I'm going to educate. I'm going to tell them why it's important, and I'm going to give them the risks of declining it, not getting it.
Right.
And then in those situations, I typically have the family, kind of depends on the scenario, but I'll usually have them sign out against medical advice. So I'm still treating them. I'm still giving them antibiotics if they need that. I'm still doing everything they need, but you are not taking my medical advice, and I cannot take that risk for your kid on my conscience. Like,
Right.
not even, yes, my medical license too, but my conscience. Like, I can't. And so I'll have them sign out against medical advice. But yeah,
Right.
that's been going on for. Mhm.
It's scary because, I mean, tetanus is, it's $1 million illness. And this is probably costs from 10 years ago. If you get tetanus and you have to be intubated, sedated, paralyzed, and flush the toxin out of your system, you will spend enough time in the ICU and it will be $1 million ICU stay for a free vaccine. So, I
and
mean, this is
and
one
like
of those examples where I mean, it's just the amount of medical resources we have to pour into one tetanus patient is not worth, refusing a vaccine that's just going to give you a sore arm. I
and
mean,
so yeah, and CB is asking too. Could you talk about the mechanism of tetanus vaccine helping a recent wound? And and so tetanus exists, right? It
yeah,
exists. It's out and about. And so if
it's
you
ubiquitous. Yeah,
it is ubiquitous. And if you have a contaminated wound, I tell the story about my very cool fleur de lis doorstop for my door that's
yeah.
very like chic, rusty, and I stepped on it barefoot and I
Oh
impaled my
no.
foot. Yeah. Jack was out of town, of course. My kids were
Yeah,
little. I They had to get the babysitter to come because I couldn't remember, because Jibby was, I know I got my Tdap when I was pregnant with Jibby,
right,
but at the time he was like 7.
right,
So I was pretty sure, or 8.
right,
It was an age that I was like, did I get it when I was
right.
pregnant for Henry? Like, but I was pretty sure I didn't. And so it's like empirically treating something with antibiotics. So if I check your urine and I see like a few bacteria, but you have a bunch of white cells
Right.
and some other things, that I'm going to empirically treat you with antibiotics until I have your culture back. And if your culture is negative, then we can stop the antibiotics.
Hmm.
Um, so that's easy. So if my wound gets contaminated with tetanus that is all around, then I die.
Right.
Yeah. So it's like empirically treating you for something that could kill you.
Yeah,
Yeah.
definitely. And even if it doesn't kill you, it will leave you permanently harmed, maybe even disabled. And you would need, I mean, I have no idea how long you would have to go through physical therapy after being
If
in
you
an
survive.
ICU for weeks.
Yeah. Um so CB says wait. So CB said the post claimed the vaccine wouldn't be effective fast enough to help. I mean, if people want to roll that dice,
Sure.
like play that game of Russian roulette, then like live your life. You're gonna sign out AMA on my watch
Right.
because
I
mm,
would I would still highly recommend it. I mean, I had a kid that he did the step on the rusty nail thing, and he was about 3 months away from getting his Tdap for his normal checkup. And yeah, we held him down and gave it to him. I said, "You have to have this." And yeah,
yeah. So I do want to talk about. I wanted to get to Pertussis.
Okay.
Um, I we can just you want to just do a little bit of pertussis right now, a little bit of whooping cough.
Sure. Sure. So, yeah, whooping cough, our good friend, the 100-day cough. Even if you're treated, you're going to cough for 3 months. And that's in an adult or a teenager. If you are an infant and you have not been fully vaccinated, you will go to the ICU. Period.
So
Period.
yeah, and if you've and I would encourage people to watch, like just search on YouTube whooping cough in babies, in
Right.
children, even in adults. It's violent. It is a violent thing to witness. it's
Right.
it's painful to watch.
You cough until you run out of air. It's that, and I'm
You're
I'm toning
downplaying it,
it
yeah.
down so that I don't like break the microphone because that's how loud it is in real life. It is a horrific, horrific sound listening to a child choke to death due to whooping cough.
Not be able to keep anything down because they're coughing to the point of vomiting nonstop. So this kind of all ties together and into, like, I want us to land on Medicaid, but I did an interview with a reporter who freelances for NPR last week, and she wanted me to talk about pertussis in Louisiana. I'm in Louisiana, just in case people weren't aware.
Yes.
Um, and report that there have been two neonatal deaths in Louisiana in the last 6 months from pertussis. And so we kind of talked, and I said, let me just look into a few things, and then we'll talk again. And uh, it's pretty. I would say the word horrifying because we don't have access to surveillance data like we did before this administration came in. And that's
It's restricted.
very it's practicing medicine with your hands tied behind your back, right?
Yes.
So I hadn't even heard about these deaths, and then she and another colleague shared a screenshot of an email that was sent in this one hospital system that said, "Hey, really encourage your patients to get this vaccine," and they really deal with newborns, because we're seeing this, and we've had some deaths. And so then I'm searching, and I did a reel about this. Like, I'm searching on Louisiana and the pertussis cases, and I find an article from early January, and this guy is giving, like, from last year to this year we've had a huge uptick in cases, um and he gives links to LDH and the CDC. But again, this is from the beginning of January, and
Right.
so at that time surveillance data was available. When I click the link for the CDC that he's linked, page
Hmm.
not found.
Oh no.
Page not found. So when I search pertussis, it brings up just general information. But when I click on the surveillance data tab, again, page not found. And so I don't even know how this reporter, aside from that leaked email, how the reporter found out of the two deaths. And then there was a story, a news report out of New Orleans, again, that noted the two neonatal deaths. And I cannot find that information anywhere on the state's website, which I think it's a travesty. I think it's gross negligence. I feel for parents of newborns and parents of kids who can't get vaccinated.
Right.
They're not old enough.
Right.
They've had a serious potential allergic reaction to the vaccine, which
Right.
I was in a physician group thread earlier today, and this amazing allergist, pediatric allergist, said, it, like, let us do the heavy lifting. If you think one of your patients had an allergic reaction to a vaccine or a vaccine reaction, like, let us investigate and figure it out.
Hmm.
And I was like, that, yes, like, let's
Yeah.
all work together. But that's how it should be. We should be sharing information, we should be
Right.
working together. And I
I,
can't
I
even
I
educate my
always give the
families.
reaction the benefit of the doubt. If somebody says this is what happened when we gave this vaccine, I'll give them the benefit of the doubt. And then if I decide to do further testing to confirm an allergy or do a food challenge or send them to the allergist to do skin testing, that's kind of the next step.
Yeah. I just, it's very concerning to me because, and I don't know about Oklahoma, but Louisiana does have rising cases of pertussis, way more cases than we
Right.
did last year. And parents don't know this.
No.
And I don't have access to the accurate data to share with them.
Right. We'd have to just be straight up anecdotal.
Yeah. So
We would have to
now,
call our colleagues in different locations and say, "What are you guys seeing? Can you tell me your diagnosis codes?"
which is kind of, I don't know about in the outpatient world, but in the pediatric emergency world, it's kind of what's happening in our listservs, in our we have different Facebook groups, social media groups, and where we'll bounce things off of each other. But that's where we are now, which is
Right.
wild,
It is
wild.
that we're going back to, how we might have done it pre-internet
Yes, yeah,
is, a, a tree of phone calls.
yeah. And I can't. I also can't say this enough, and I've said it multiple times, but on like every platform that I educate on, but all of the data that we have on febrile neonate workups. So if you have a mom with a newborn or less than 6 months of age that calls
Right.
you and says my baby has a fever, and you're like, ooh, you're gonna need this workup, right?
Right.
All of that data, because the way we do it now is very different from when we trained. When we trained, if you were less than 2 months of age or too young to have had your 2 month immunizations,
Right.
every baby got blood culture, urine culture,
Yep.
spinal tap, right? Like every baby, you got admitted for 48 hours on
Yep.
antibiotic. Like this is what we did. But then I always tell parents, a lot of really smart people did a lot of really good research.
Yes.
And now we know how we can stratify it out based on days of age.
I mean, it
But,
is 42 pages long.
but shout out to CHOP, to Children's of Philadelphia. You can Google CHOP emergency pathways and and click on neonate with fever, and they have this beautiful algorithm
Okay.
with all
I'll
of
have
the
to look into
literature.
that because I remember it right now because when I was doing maintenance of certification last cycle for 2024, many of the questions were based in the protocol, which is a 42-page document with, you want to just kind of get to like, okay, what are the recommendations? But they don't just tell you recommendations, they stratify it by how good of a recommendation it is. And then you're like, oh dear.
Yeah,
So
no,
it's not just 42 pages of very detailed information. Then you have to go through and remember, okay, well, this recommendation is A, and this recommendation is B, and this recommendation is C. And just like grades, A is the best, B is,
my
moderately
friends,
good, and C is mediocre at
let
best.
me
So,
walk you over to
right,
pathways. Amazing, amazing resource for so many things. But it's this beautiful tree, and it gives the age, like
good,
0 to 14 days, 14 to 28 days, 28 to, like, it breaks it all down. And it's a guideline, right?
right,
So obviously you might have your gut or your, like, even though this kid is low risk, I have
right.
some questions.
Well, and I had a
I don't,
really interesting case. It was exactly 3 weeks old. A little guy was exactly 3 weeks old, and he had an abscess on his chest.
oh, you got to work that up. At
So,
least
I
need
mean,
like,
I had to send him to the children's hospital because I knew he was going to have the full workup. I didn't even send him to my local ER because I was concerned if they would even draw blood. But luckily, when I called the Children's Hospital emergency room, they very politely, can you repeat the age for me? Because I was like,
Yeah.
he's exactly 3 weeks old. They were like, I could tell the pause in their voice was like, darn, because they knew they were
Yeah.
going to have to. And I was like, I actually think it's just this abscess on his chest, which obviously is a rare deal as well, because it kind of looked like just some estrogen effect, but I was like, this is really red, and there's a pustule. I'm like, this poor little guy.
Yeah.
So
Yeah. And so,
little guy.
so has done what Children's of Philadelphia has done with this algorithm. And so they did the heavy lifting, right? Like they
Good.
did everything to put this
I'll have to
algorithm
look that
together.
up.
And it's amazing. But my question to colleagues has been, all of that research was based on our assumptions on herd immunity
Hmm.
and decreased levels of these infectious diseases in the population. And so, how does that change the way we practice specifically for neonates, the most vulnerable,
Right.
as far as workups go? And anyway, it's a to say the least, it's been a very interesting um
Right.
discussion thread because we want to do the right thing. We want
Right.
to make sure we're taking the best care possible of these patients.
So what you're
Um,
saying is, in addition to the recommended protocol, you might have to modify some of the testing based on what might be going on at the time in terms of vaccine preventable illness. So
so
you're mentioning you're seeing more pertussis, so you're like, I better include a pertussis PCR in this workup when I normally wouldn't.
a
So
newborn not long ago,
excuse me.
cough, family like we're seeing pertussis now. Like we
Right.
need to add that on.
And
Baby
sure
also
enough,
came in with a rash and temporally related to maybe a formula change, but also cough, congestion.
coryza.
So, and I told the family, I'm like, maybe it's overkill. And the family's like, we don't care. Do all the
Yes.
things, right? And which is the appropriate response. Do all the things. And so I did the things. And the baby ended up being okay, but these are the things we're having to like day to day. Uh,
Think about.
yeah. And I don't want to say we're not thinking about, but like you said, the fever research is 40 pages. I can't go through that in the ER when I have a ER full of patients, right?
Right.
So I need that quick go to,
Right.
but it's not applicable in all circumstances now.
Right. Well, I
Which
mean,
is
it's a good start, but you do have to follow what you might be seeing more of, and then like you said, you have these listservs and these phone calls with your colleagues in the surrounding areas to go, hey, fellow ER colleague, what are you guys seeing right now? What is testing positive? So you can kind of have an extra, you know, an extra piece of suspicion when you're doing that neonatal fever workup.
yeah. I'm gonna hit a few questions. So CB is asking about Medicaid, and we're that's next. We're getting to Medicaid. Alexandra asked, how is Louisiana's change in vaccine policy and programs going to affect this? Do you know about this, Pete? Maybe you've seen my
Yes,
post about this.
I have seen what Louisiana is doing, and Oklahoma is not quite to that extreme, but
It's
we
close,
we
right?
have done some things that the health the state health department has done some things I'm disappointed at. The most disappointing was in 2023 they just basically said, yeah, we're just not going to get coronavirus vaccine for children under 5 at all. We're not going to carry it. So last year we didn't there it wasn't available at our health departments.
Love that for y'all.
So that was kind of like what Idaho did, and then I think some of your politicians took it a little bit further in Louisiana. So you can go into more detail if you'd like.
Yeah. Okay. Buckle up. So, Senator Cassidy, Bill Cassidy, is a physician. He's a hepatologist. He's chairman of the Health Committee. So, what is it?
For now,
Health. Mm-hmm, mm-hmm. What is it? Health in education, labor. I'm bad at politics. This is where I wish Jack was here, and he could be like, "Ugh, don't you know this?" But let's focus on the H, right?
yes,
So
health.
the H, health, and he's a hepatologist, and he has historically been pro-vaccine. He even like championed a program here in Louisiana for hepatitis B vaccines, another vaccine that can prevent cancer, which is like kind of a big deal, right? Um, and so leading up to RFK's nomination and the hearings, um, my husband was he does a lot of work in Washington surrounding coastal restoration and renewable energy. And knowing some of our state leaders, he was pretty confident that Senator Cassidy would side on the side of science. I was not.
So,
I never
so
was.
were we, but I didn't give much
I
hope
was
to it.
realistic the entire time. I called it from the beginning. He's just to get a little bit political. He's towing the party line because his seat is in jeopardy, and so
Yes,
he's pandering. I'm saying it. He's pandering.
yes.
And so he got these concessions from RFK. We're going to meet once a month. RFK is going to follow the science on vaccines if it exists. I'm like, what alternate reality is this? So I have this Zoom meeting with some amazing other leaders. It was actually after Cassidy voted yes,
Mm-hmm.
with Cassidy's head of health policy,
Right.
and expressed my disappointment. And his response was, well, there will be people upset on both sides of this issue. And I'm like, who cares if people are upset?
Upset on both
People will
sides.
die.
What?
Like the
There is no
morbidity
both
rate,
sides.
mortality rate, like this is, and
There's disease, and then there's science.
that's it, right? Like that's it.
That's it.
So, so they announced that RFK is, yes, like he's going to be confirmed. That same day, Louisiana leadership, our Governor Landry,
A real character.
and our Surgeon General, Ralph Abraham,
Great.
who is a physician.
That's disappointing.
He is a former congressman.
Oh,
He holds the seat, he held the seat that um, Congresswoman Julia Letlow now holds.
okay.
She ran, so Julia Letlow's husband won. I believe he worked for Congressman Abraham
Okay.
for years, and so he ran for that seat. He won that seat. This was early COVID time. He
Mm-hmm.
had an election winning party. What do you call it? I'm like drawing a blank. Like a campaign. He
Right.
won. Election
Right.
night, he won. He had a party. COVID. He very sadly,
Unalived.
tragic, young guy,
Crazy.
healthy. So a special election is held. She runs in his place. She wins the election. I
Ah,
digress. So former Congressman Abraham is a physician. He was a former veterinarian. He, after 10 years of practice, went back to medical school.
mm,
Great. I love when people are veterinarians and physicians. I love
yeah.
it. I love asking them
It's
questions.
pediatrics.
I think it's fascinating, right? Except with like species, right? Like it's wild. But he goes back to medical school, and then here's the kicker. So he does 1 year of a residency. So to get a state license, you only have to complete 1 year of a residency. So he does 1 year of a residency, and then he becomes a general practitioner, which I am 46 years old. Pete, I got to tell you, I was 46 years old when I realized this was a thing that
I
you
wonder
could
if
go.
Florida allows that.
Oh, I see where you're going with that.
Because I've seen
So,
some of these Florida doctors that are on their social
they
media.
well, the state's website. So Governor Landry appoints Ralph Abraham as the Surgeon General, um, and his biography on the website says that Doc is a family medicine physician. He is not family medicine. Family medicine is a 3 year residency.
At
Lots of
least.
fellowships exist, right? That they can do additional training. My uncle was family medicine, residency trained, board certified. He is not. He's a general practitioner. He is board certified by the American Board of General Practitioners. I've searched this. There's not much
This
information on this,
exists?
in
Oh my
theory.
goodness.
So, and he has no background in public health.
No.
One should have to be Surgeon General for a state or
Yes.
the nation. Anyway, so in the past few years, he was not always like this, but in the past few years, he has become very anti vax. He didn't believe the science on COVID, he didn't believe in the COVID vaccine. And so he has been very vocal in his anti vax.
Rhetoric.
Mm-hmm. And so this same reporter that I talked to last week from NPR is the one that wrote the article in December, I think it was December, about LDH workers. So that's Louisiana Department of Health
Okay.
workers coming forth anonymously to say, hey, they're not letting us talk about vaccines. They don't want us promoting vaccines. They don't want to do seasonal vaccine fairs.
Mm-hmm.
And so she's the one that wrote this article. And then the day that RFK was announced,
Mm-hmm.
he will be confirmed, or maybe it's the day he was confirmed. Louisiana issued a statement. They will no longer be promoting vaccines, and they are banning seasonal vaccine events.
Hmm. So
We have
they're
been
not quite saying
surging.
you can't get it, but they're making it your responsibility to go out of your way to get it.
Correct. So they're saying, we're not saying you shouldn't get it. We're saying you need to talk to your primary doctor about this. So they're eliminating vaccine fairs where people can just, hey, we'll all go, we'll get this done.
Right.
It's easy. Costa Rica does,
Mm.
they bring healthcare to the community, right? Like,
Right.
and that's been proven time and time again that it works, it's effective, it's great. They've
Especially with
eliminated
people that
that.
don't have reliable transportation or the socioeconomic means.
Correct. Correct. So they've wiped
Yep.
that out.
Okay.
Louisiana, Landry has been in office for, I think, a little over a year. Louisiana has had, oh, what? Wait,
You might be getting your puzzle.
I am getting my puzzle. Hold on. I've never gotten a puzzle. How do you do this?
You just slide it over until it fits in the space.
I was sliding it the wrong way. I'm so
It's
not
okay.
smart. I'm smart at the things that matter, but not these like puzzle things. Um,
No worries.
so
I will guide you through it.
So Landry has been in office for a little over a year, and Louisiana, and so they started to drop off on flu vaccine information, et cetera, last year. Louisiana has had, before the current administration eliminated surveillance data, Louisiana was always that dark, dark purple, which is the highest rates of
Right.
flu um, from November. And so now we're at the end of February, and we're still maybe now slightly declining rates, but I've never seen 4 months.
I think we're about to have our second flu A here. That's the problem is
So
now I'm seeing kids who were exposed to flu A a month ago and they're getting flu A now. And I'm like, that's got to be a different strain.
probably,
And then
I mean,
one of the creators on here, Beach Gym, has said there are confirmed two different strains of flu A in Florida. One of which is H1N1.
uh, oh,
Yeah,
that's a fun one from
that's a
like
fun one.
2008, 2009.
That's a real
Highest
fun one.
rate of pediatric mortality.
Yes. And I
Am I
think
allowed to
that's
say
why the numbers
mortality?
are
I don't
up,
know the
but
rules.
we lost track because they stopped counting them. And the AEP is still mentioning it when they can get information. But as of right now, I don't know that we're tracking pediatric deaths other than when they get put in the news.
I mean, well, right, because we can't have,
I mean, we're flying blind.
right. Wait, so our good buddy, Dr. DCN Peds Doc Mo, is here, and I don't know if you're still on. I want to invite you to talk with us. Pete, how do you do that? Can you do that? I don't know how to do that.
I think I can invite another guest if they're
I click on
live.
host. Oh,
So the person has to like the reason why I could invite you and then it put us like side by side is because I was live, you were live, and then I just invite you, or you could have it has to be an invite
gotcha.
from somebody, and you can have several, but they have to be live as well.
Okay. Well, maybe she's
They'd
not
have to
on.
request. There you go. So they'd have to come on to a live and then request to be part of the discussion.
Yeah.
So if they're in the
So,
comments and they're on our live, they could request it.
okay. Well, hopefully she's still here and didn't, because
Yeah.
sometimes I'll do a quick bounce in and out. I'm like,
Yeah.
hey Pete, and then like out.
Yeah,
Um,
our one of our I think it's our Kentucky colleague was on earlier. Have you ever chit chatted with Heather Felton?
so yeah.
She's a delight. No, she's awesome, and she does lots of very educational, very well spoken videos. She's still on a train. She's still training residents, so she's a younger doctor, but she is training residents.
Now I still train, but I train mostly EM residents, so
Right.
mostly
She's
emergency
general
medicine.
pediatrics. Yeah. But
Um,
she's awesome. She's done a side by side with another pediatrician. So I'm hoping more of us do this. It's great.
yeah, and I like having these conversations together. Wait, so I Amanda Rose, we just got my 6 month old vaccinated for COVID. That's so awesome!
Woo!
That's so awesome. Um, wait, there was another
Well,
question. Oh,
there was an odd question earlier, and I'm not sure if it was genuine, and I don't think the questioner is here anymore. But they said, "Which pharmaceutical companies do you like to work with best?" And I will say, I like when they buy me lunch.
I just want a pin, Pete. Listen.
I want my lunch and then I want to go home and take my vitamins.
See, I don't have any right
But
near me, but
we don't have a favorite. I mean, some of the representatives are like-minded to me. So the last one I talked to was Merck and we talked for an hour, but it was about politics.
so we don't. So in the ER, we don't never like pharmaceutical companies don't come to us, right?
Yeah.
We don't get anything like that. So, but all I ever want is a free pin. Like
Yeah, I don't
that's
even
all I
think
want
they
is a
give
pin.
those out anymore. And someone asked
Right.
me like,
My
Don't
husband
they give
Jack
you pens?" And
goes.
I'm like, "No, they really don't. They give us pamphlets and lunch, and that's it."
So my husband goes to the I call if anybody on here is an engineer, but my husband goes to these engineering conferences. I call them nerd conferences, lovingly, very
That's
lovingly.
fine. That's
But
fine.
they have the best pens, and
Oh,
so
I
he
bet.
brings them back. I mean, sometimes it's like a freaking multi tool. Like it's a pen with a
Oh,
level, and the
that's
other side's a
awesome.
pencil, and then it also has like the iPad thing on it,
A
right? Like the
stylus.
Oh my God, they're amazing. Like, but I'm
Yes.
here for
I
the
only
simple
have
stuff
two of
too.
those. I have the stylus end and then the pen end. Yeah.
So Alexander brings up an excellent point about Mardi Gras. So,
That's
yeah,
coming
yeah.
up.
Oh, and Alexandra is a nerd like that.
Very good. We
So
like
she is.
nerds.
We do. We love nerds. And we are nerds, but we're different kind of nerds.
Yeah, you can see on my shirt. It's Star Wars.
But Mardi Gras is going to be a super spreader event for all the things.
Oh yeah.
The one like least with Mardi Gras, and it's still like Mardi Gras wasn't canceled in 2020, and that
No.
led to a tremendous super spreader event for COVID, right?
Yes.
But at least for the most part, Mardi Gras outside.
Yes.
So the parades are outside. I mean, there's a lot of balls that are inside, but still. Um, so yeah. Amanda, I wanted to see if y'all had any opinions on getting the measles vaccine early. So somebody asked this on my Facebook group or earlier this evening about having their baby, like, can I get my baby vaccinated earlier? Like, why is it 12 months? And it's because you retain immunities from mom. By you, I mean baby. Baby retains immunities from mom, and then those immunities start to wane around a year of age, and so that's
Yes.
why the recommendation is 12 months of age. In wait, I'm gonna save you all of my engineering pins for if I see you in the ER again. Yes, yes. They made. You just have to. My
Well,
affection
now
is
now I
dogged by
know
a
what
cheap
to get
pen.
you for a Christmas gift. Is I will go on Amazon and find the most multi-tool engineering
But
esque
it doesn't
pen.
even have to have like fancy stuff. You know, like if it fits in your hand right, like it's got the right balance and it just has the right like that ink flows the way it's supposed to. And like we
You
don't need a
know
paper
that
chart
is a
anymore.
lost. That's a lost like art. Is a
Yeah,
good
yeah.
pen.
But anyway, so that's why we do 12 months for right. So he's technically has immunity for MMR since he's 6 months old. That's correct.
Yes,
From you.
mom.
Thanks, Mom. From you.
That's why
But
we
yeah.
check the rubella titers in moms.
And so then there's this great graphic that infectious disease docs have been sharing. Um, and I'll share it on my TikTok after this based on what year you were born. So when you were vaccinated for MMR, do you need another MMR or are
Yes,
you okay? And a lot of that is a gray zone, honestly, that it says um, check with your doctor
yes,
because you may still have immunity and you should probably have titers drawn. That being said, that's a little, I'm just going to say it, it's a little bit of an elitist take
right,
because not everybody has access to a primary care physician
right.
or they can't get there or like lots of other reasons. And so my question to an adult ID physician was, you know, if it's been 20 years since you
Right.
got like is there harm in getting vaccinated again?
No.
Yeah.
For on.
So with my anxiety I'll be back in the ER at the next little sniffle, which I tell parents all the time. I'm happy to see you in the ER.
Yes.
I would rather you be safe than sorry.
Right.
I love the little like I and honestly there are no pediatric very few pediatric specific urgent cares. Those are in very populated urban areas. So like
Yes.
New Orleans has several of those.
Yes.
You know, the where there are large pediatric centers, they'll have
Right.
little satellite urgent cares. But
Yeah, like
that's not
Dallas Fort Worth will have that. My in-laws that live in McKinney, they have a Cook Children's and a Children's
yeah,
Hospital.
but that
Dallas.
is not available to everyone.
No.
And so this is my soapbox that the quality of your pediatric care should not be limited by the zip code in which you live. This is my soapbox. So have pediatric specific urgent care, and even then, like you really don't know who's working there unless it's affiliated with a children's hospital.
Right.
um, then at your community hospital, like make sure you're seen if you're going with your child, make sure you're seen by an emergency medicine physician because
Yeah.
they are trained to see kids. But
Yes.
not all community hospitals have
No.
emergency medicine physicians on staff. So
No.
then
Ours does not. They do
I
not have.
empower
We had
parents that
one.
say,
We had one for a while, and then they switched to another group, and this new group, none.
"Oh, private equity in healthcare."
One
We
one
won't
of the
we won't go
doctors
there.
that I want to say moonlights, he's contracted with the current group in our small ER. He's literally an ophthalmologist,
Mm-hmm,
an eye doctor
mm-hmm, mm-hmm,
doing ER.
mm-hmm.
I mean, that's
Even
great if he has an eye emergency, but what is he going to do with a heart attack or a Feb Neo?
no federal regulations on who can work in emergency departments,
That's abysmal.
which is a whole, like we could do a whole other live about pediatric readiness, which is another one of my soapboxes related to quality pediatric care and how many community and critical access hospitals don't have pediatric supplies.
Right.
Anyway, all of that. Let's wait, I'm just gonna cruise the questions really quickly. Yeah, even in New Orleans it's hard to get same day appointments sometimes, and like everywhere.
I mean, we
Um
we love to, but I'm also battling with the convenience of urgent cares, even though they are not pediatric and they're not the best care. People want to go after work. They want me to. It's almost like I could just not even open until 3 p.m. and work till like 8 o'clock at night.
yeah.
I'd have plenty of patients,
Well,
but
and
I
this
can't.
is
I can't find staff that wants to work those hours.
so when I was in um leadership, I this really made me so angry every time non-clinical administration would talk about ED overuse. And I'm like, you don't understand what parents go through, right? Like, they're working, the kids are at school, the kids get home from school, they realize the kid's sick, for whatever reason, that's when that happens.
Yes.
You can't get an appointment in the next hour.
No.
A lot of people don't know, like, should I get seen today or can this wait tomorrow? Yeah, Pete's on the call. I think I can keep talking because I think I'm on mute. I hope I don't disturb him. But um, so parents, a lot of parents don't know, is it emergent? Do I need to get my kids seen today or can I wait till tomorrow? That's one thing.
I gotta
And
go
so
check
then,
my on-call app real quick.
yeah, yeah, yeah. Go, go, go.
I, s- I still get mommy calls.
Go. No, thank you for joining us. So hopefully he'll come back. But so ED overutilization, um, if parents don't like, they're just getting off of work. They can't get into their pediatrician. They don't know, does this need to be dealt with today or can it wait till tomorrow? Then the whole rule with schools, right? That you need a doctor's note. Don't get me started on that. That's a whole another thing that like I understand and also makes me really angry. But all for all of those reasons, parents will turn to the emergency department. And so when non-clinical administrators will say, you know, there are too many patients coming into the ER for non-emergent reasons, that just
Okay,
really
so I'm back for a
put me off.
second, but I'll have to sign
Yeah.
out. I have to call a mom back on her little boy.
Okay, well then let's super fast, which is not a super fast topic, but can we just really quickly
Yeah.
touch on Medicaid cuts?
Okay. So I am a Medicaid provider, and in the state of Oklahoma, Medicaid is designated Sooner Care. In Tennessee, where both Dr. Saucier and I trained, it was called 10 Care. So each state, all 50 states, call your Medicaid something differently. Medicaid covers pregnant ladies and children, and in some states, socioeconomically disadvantaged adults. It just depends. Every state's a little different on if they cover the adults.
So
States like
Pete,
Oklahoma, go ahead.
how many kids in Oklahoma are covered by Medicaid? Because in Louisiana it's 70% of kids.
So in my area, it is 80%, and in Oklahoma, our Medicaid relies on 80% upwards, depending on the year. But in some years, we've had to have 80% of federal dollars to fund our Medicaid. For example, though, a different state like California would be 50-50.
Mm.
So they get maybe 56% from federal dollars, but they fund the rest. But Oklahoma is very dependent upon federal dollars to the point where some years it's 75, some years it's over 80%.
And so
But I would say
so
out of the million kids, maybe 400,000 or 500,000. So I don't know if it's 70, but I think it's up there.
I so what's happened, like make no mistake, right? What happened last night um doesn't it's not explicitly stated we are cutting Medicaid funds. But
Right.
and I had to write this down because again, I'm not great at politics.
It's
Although
sneaky. It's like they're saying $88 billion every year for 10 years.
so they've turned to they told the House Energy and Commerce Committee has jurisdiction over the Medicaid program.
Okay.
And they have tasked them with cutting spending by 880 billion over the next decade. Um, Basically to cut corporate tax rates, right? To have
Correct.
that money. And so then the
Oddly
leadership has
enough,
said,
if you're a wealthy enough physician, it might benefit you. The tax cuts. So that's where the 40% of us are like, well, I want the tax cuts. I don't care about the kids.
number of physicians who support this administration is,
There's a
and
special place.
there's a there's a special place.
There's a
And
special place.
I've had this conversation with people. I would rather pay more than I'm currently paying in taxes, which is a lot of money in Texas.
It's a lot.
Okay. It's a lot. It is almost 40%, right?
Right.
In taxes. I would rather pay more taxes if it benefits the greater good, especially kids,
Yes.
than have tax cuts for myself. Like,
Right.
and so so impactful. And I think CB had asked earlier, like what this means for, like if Medicaid goes away, um, what does it mean for the ER and
It's
all of
bad.
those kind of things. And it's, but I think people don't understand that it's bad all the way around
Yes.
because when Medicaid dollars stop, then hospitals raise prices to private insurers, and then private insurers raise the premiums for everyone else.
It would be like a
So
mega inflation event.
no, yes, nobody benefits from this. Like, I mean,
No.
the multi-billionaires, right? Like, I
Well,
guess.
the guys that own the insurance companies are loving it.
Mm, yep.
The private equities, the CEOs, they're like, "Oh, this is good for the bottom line."
Yeah. And the bottom line, and again, we're peds, right? Like we deal in kids. So the bottom line are the lives of children.
Yes.
It's the lives of children. It's the health, the safety, the well-being of children, and by default, the health, the mental well-being, etc., of their families, because they are having to care for kids, right? Like this is wild to me. And so a lot of people have asked, especially with RFK and not supporting vaccines and science and the AAP's recommended vaccine timeline, like what does that mean for insurance coverage and private insurance coverage, et cetera? And and so I have told families like really great pediatricians will continue to carry vaccines even if it's at a cost to their practice,
Yep.
even if it means their practice loses money because you have to feed your family, your
Yes.
staff has to feed their families. But even if it's at a loss, I know that pediatricians like you will continue to cover. But private insurances follow the essentially follow the patterns of reimbursement made by CMS, by the Center for Medicaid and Medicare Services. And
Right.
so if CMS says, under RFK says, no vaccines,
Right.
or we don't believe in these vaccines,
Devastating.
then devastating to
Then
insurance
VFC
coverage.
goes away.
Yeah.
The people that can't pay for their vaccines. Health departments close. Then
It's
people just getting care to make sure they don't have syphilis or tuberculosis.
and we're already seeing that trickle down effect in Africa, for example, right? With
Right.
USAID and the closure of the HIV clinics
Right.
and the
Within
number of
within days.
and I think like I don't know if I'm sure the people that are watching us right now realize this because they're informed and educated people who want to learn more, but babies born to HIV infected mothers now, because of the advances in science, do not have HIV, right?
Right.
Mom stays on antiretrovirals and things keep going well. Like, then these babies thrive and do well. But when
Mm-hmm.
that stops,
Mm-hmm. Comes right back, and then it's devastating.
yeah.
So yeah,
So,
there's not a good outcome here. It's really just hoping that some of these senators will look at the cuts and go, "Holy cow, you guys are nuts." And they'll realize that any cuts to any entitlement service is political suicide, even more than going against the current administration,
yeah. Well,
because there are a minimum of 80 million adults and children that would be harmed by a full scale Medicaid stop. And then there's countless other tens of thousands, hundreds of thousands that are caregivers, that are providers, nurses, respiratory therapists, doctors, nurse practitioners, physician assistants, all these other people that would be either displaced from a job or just have nowhere to work because things start closing down. So, yeah, a total cut would be, collapse of the healthcare system, but even the slightest of cuts
it's a huge impact, negative
is a huge
impact.
impact. And then for states like Louisiana and Oklahoma that probably rely up 75 to 80 cents on the dollar to keep Medicaid going from the federal government, their impact is double what everybody else is. So I calculated it out. I'm like, well, if we rely on $2 billion from Uncle Sam, but we have a $9 billion budget for Medicaid. That's a pretty big shortfall. That's a 25% cut.
Yeah.
And that's bigger than what they're proposing, 10% cut over 10 years, if they spread it out nicely, which
Yeah.
that seems to be their sneaky way of letting people down easy. I'm like, but a 10% cut for California is totally different than a 10% cut for Oklahoma or Louisiana
Right.
because of the structure of how much funding and help we need. And again, you know, we can't avoid politics. Red states versus blue states. Red states need more assistance because their economies and their populations do not support the services that their populations need. Period. And then if you're talking about a state, you have to have a balanced budget. There's no such thing as a state that can run on a deficit. Only the federal government can run on a deficit. And our deficit is $30 trillion right now.
And
So
I
I get the fiscal conservative side that says we have to cut this, but then I'm like, but you guys spend 2 trillion on defense, so cut defense.
yeah. Or
Stop spending $2 trillion on defense, and you could certainly fund the government for the necessary services like health and housing and all the things that keep people alive, as opposed to these things that are meant to be a big stick. It's like, well, why do we need a big stick anymore? Who are we fighting? What war are we in yet?
yet.
Yet. So you're going to make up a reason so then you can spend more. I mean, this is just classic
Yeah. And
military industrial complex.
when I got my master's in healthcare administration a couple of years ago, and one of the common like underlying questions in multiple classes was, is healthcare a right or a privilege? And I think healthcare is a right. And I
It's a
think,
pretty simple answer, but if you ask the wrong person,
but for those that say it costs too much money for it to be, then we go back to what we just talked about, right? Because then if you're cutting that off, you're cutting off that healthcare, then the cost for everybody else goes up. So it makes zero sense. Like
right?
you're going to increase disease rates, morbidity,
Right.
mortality. Like I mean, we could go on and on, right?
Yeah.
But I don't know. You have
Well,
to
I
go.
think I think that's it in a nutshell. Is there are consequences, and I really hope people's um, attention span remember this when we come up on special elections and midterms, and they do the right thing, which is enough is enough. The people that don't want to put their constituents, the actual constituents first versus the pretend constituents that line pockets, then we're not going to get anywhere. So,
Right.
well, anyways, I'm going to go call this mommy. I think we'll go ahead and
Yeah. Thank you, Pete. Thank you
sign
to everybody
off.
that joined us.
Yes, thank you
I
very
really
much.
appreciate it.
All right, well, take care. Give those boys a hug.
Bye.
Bye bye.